Among the surgical approaches for the heart and the blood vessels, we have discussed about the medium sternotomy in the first lecture. In the second lecture, we discussed about the uh, thoracotomies, lateral, axillary, and posterior lateral. And now in this lecture, we will mainly focus on the alternative surgical approaches for the uh, approaches to the heart and the blood vessels. So अल्टरनेटिव में हम क्यों अप्रोच जो है वो करते हैं, बिकॉज ऑफ द अर्ली रिटर्न ऑफ द पेशेंट टू नॉर्मल फिजिकल एक्टिविटी, उसमें कट कम होगा. दूसरा जो है वो कॉस्मेटिक रिजल्ट्स जो है वो हम अचीव करना चाहते हैं, बिकॉज एंड डिक्रीज द पोस्ट ऑपरेटिव पेन. So in addition to smaller incision, minimally invasive approaches are being introduced to avoid sternotomy, although to get to perform cardiac surgery without cardiopulmonary bypass, जो minimal procedures होते हैं cardiac की. Two of these techniques involve a full sternotomy through more cosmetically acceptable skin incision, जो कि यूजुअली हम फीमेल में प्रेफर करते हैं एंड जो यंग एडल्ट होते हैं. एंड टू मिनिमली invasive approaches include lower or upper mini sternotomies or submammary right thoracotomies. Full sternotomy through submammary incisions, a bilateral submammary skin incision results in a cosmetically acceptable scar and is used in girl and young women undergoing more complex cardiac procedure requiring a full sternotomy. Skin incisions are made a few centimeters below and parallel to the lower chest contour of both breasts. The incisions are joined in 0.5 midline at the level of the junction of the sternum with the zipide process. So the full sternotomy through limited midline incisions, this is another approaches जिसमें क्या करते हैं हम full sternotomy करते हैं allow for the safe access to the heart, और जो हम allow करते हैं performance of the most cardiac procedures. It has been approaches of the choice since the birth of the cardiac surgery, जो full sternotomy है with through limited midline incisions. So therefore performing a full median sternotomy through a limited skin incision is the most appealing. टेक्निक क्या हो सकती है, आपने मिडलाइन स्किन इंसिस की हैं, स्टार्ट एट द लेवल ऑफ द स्टर्नोमैंडिबुलर जंक्शन, उससे स्टार्ट करने और एक्सटेंड करना करता है आपकी टू डोर तक कोई जो जिपाइड प्रोसेस है फॉर अप्रोक्सीमेटली 8 to 10 सेंटीमीटर डिपेंडिंग ऑन द प्रोसीजर ऑफ द पेशेंट या जो पेशेंट की बॉडी हैबिट्स है. So most mitral valve procedure can be accomplished through an 8 to 10 centimeter opening, but for the aortic valve surgery and coronary bypass grafting up to 15 centimeter में जो है वो required है. ये आप देख सकते हैं. This is the full sternotomy with the limited skin incisions. Lower mini sternotomy, we have found the lower sternotomy through a limited skin incision to be an acceptable approaches for the atrial septal defect and more ventricular septal defects. It may also be used for pump off coronary artery bypass graft procedures using the left internal thoracic artery. टेक्निक क्या हो सकती है कि the midline skin incision begin at the level of a line drawn between the two nipples and extend to the tip of the zipide process. Dissection must be carried up to the level of the tricuspid interspaces, and the pectoralis muscle is dissected off the sternum to the right or left side. For congenital heart defect, the right side is dissected, and for the left internal thoracic artery harvested, the left side is used. A saw is used to open the sternum in the midline to travel to the level of the third interspace. Then an angle bone cutter is used to divide the right or left half of the sternum into the third space interspaces. ये आप देख सकते हैं. So the lower mini sternotomy skin incision आप देख सकते हैं, which is angle bone cutter is used to divide the right half of the sternum into the third intercostal spaces. The lower medium sternotomy closure आप किस तरह करेंगे, वही पुराने तरीके हैं कि जो upper and lower portion of the right side of the sternum are reapproximated with the one stainless steel wire placed vertically. उसके बाद जो left and right halves of the lower sternum are encircled with the 3 or 4 wires. The vertical wire should not be tightened until all the wires are placed. Upper mini sternotomy क्या है? Some surgeon perform aortic procedure through an upper mini sternotomy. This incision provide adequate exposure of the aorta and left ventricular. टेक्निक क्या क्या हो सकती है? So a 6 to 8 centimeter midline skin incision is made starting at approximately 2 to 3 centimeter below the suprasternal notch. A short pleth of the subcutaneous tissue are developed both superiorly and inferiorly to expose the sternum. With the pneumatic, a small oscillating saw the sternum is divided for the suprasternal notch which is down to the third or the fourth interspaces. उसके बाद हम करते हैं कि जो एंगल बोन कटर्स होता है, we use for divide the sternum into the right, left or the both intercostal spaces. A Finquitus sternal retractor provide both good exposure. So aortic valve replacement surgical option, इसमें आपकी कन्वेंशनल ये है जिसमें आप ओपन चेस्ट और स्टेनोटॉमी करते हैं। जो मिनिमल इन्वेजिव में आप करते हैं जो राइट एंटीरियर thoracotomy है एंड मीडियम स्टेनोटॉमी है। So submammary right thoracotomy, the incision is cosmetically well appealing, very appealing for the young girls and women requiring atrial septal defect closure. It may be used for the mitral valve surgery, although access to the ascending aorta for the cross clamping may be difficult. The skin incision is made in the submammary fold to the right breast in an adult and for the anticipated future breast fold in the pre-adolescent girl. This is carried down to the chest wall and the pectoralis major and pectoralis minor incisions onto the ribs are dissected prior to the fourth intercostal spaces. The intercostal muscles is divided just on the upper edge of the fifth rib and the pleural space is entered. Sub memory right thoracotomy क्या है? So two single blade retractor are placed on the between the rib and the other at the right angle of the right retractor to spread the subcutaneous tissue or muscles. उसके बाद लंग retractor जो है वो यूज़ होती है to hold the lungs laterally. उसके बाद जो है वो हम करते हैं कि after the opening the pericardium, retraction suture should be can be placed to the allow for the exposure of the inferior vena cava and SVC and approximately ascending aorta. A tie around the tip of the right atrial appendage retracted inferiorly help in the cannulation of the superior vena cava and ascending aorta. ये देख सकते हैं आपके the first single blade retractor spread the ribs of the second single blade retractor retracting the muscles of the T-shape retractor to hold the lungs. ये आप देख सकते हैं एक ने जो है वो first rib को जो है वो किया हुआ दूसरे ने second को and third one is for the lungs retraction. The closure of the submammary right thoracotomy after the placing a chest tube through a small stab wound just lateral to the skin incision, the rib are approximated with the heavy braided sutures जो मसल क्यूटेनियस मसल्स है लेयर एंड स्किन्स आर देन क्लोजिंग द लेयर्स. ये वो जो फिंक्यूटस एंड फेलोरा चेस्ट रिट्रैक्टर्स हैं. If you have any question among all the three sessions, you can ask me, you can comment us, and if you need this lecture, you can email me and you can leave a comments. Thank you so much.